The House of Representatives voted on Thursday to repeal and replace Obamacare. Here's what you need to know. This bill is really similar to the bill that Republicans have been debating for 6 weeks now, although there are some really key differences.
The ayes are 217, the nays are 213. The bill is passed, and without objection, the motion to reconsider is laid upon the table.
The bill that Republicans passed lets insurance companies charge sick people higher premiums.
You know, before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition.
It also lets them cover fewer benefits, so they could cut out things like maternity care or prescription drugs because they think they're going to be expensive. The big question now is what happens in the Senate. There are a number of Republican senators who have already raised big concerns about the House bill. They don't like the fact that it does some big cuts to Medicaid, and it also defunds Planned Parenthood.
I don't support pulling the rug out from under those who have received coverage, and I do not believe that Planned Parenthood should even be part of this debate.
The expansion of Medicaid is tremendously important to 184,000 West Virginians.
If Republicans hold a big press conference and pat ourselves on the back that we've repealed Obamacare, and everyone's premiums keep going up, people will be ready to tar and feather us in the streets, and quite rightly.
There are a few Republican senators who are even talking about writing another bill from scratch in the Senate.
I don't expect that we will vote on the House bill as it is. I suspect we would put forward our alternative.
The president has said he is going to protect people with pre-existing conditions and not cut Medicaid.
Pre-existing conditions are in the bill, and I mandated, I said it has to be.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it.
The House bill doesn't do that, but it seems like he is ready to sign the American Health Care Act anyways. The other big question is what is in this bill for Republicans? It is incredibly unpopular. Most Americans do not like the American Health Care Act. So why are they pursuing it? One reason Republicans might like this bill is that it is a huge tax cut for the wealthy. There are about $600 billion of tax cuts in this bill, and most of them go to the 0.1% at the top. Republicans have spent years now complaining about two key things about Obamacare. They say it's too expensive and doesn't cover enough people.
There are 25 million Americans who aren't covered now. If the idea behind Obamacare was to get everyone covered, that's one of the many failures. In addition to premiums going up, co-payments going up, deductibles going up.
But the American Health Care Act could make those problems worse. The best estimate we have is that 24 million people will lose coverage because of this bill. And the Congressional Budget Office says that deductibles will go up under the American Health Care Act, not down. Republicans have spent 7 years now promising to repeal and replace Obamacare. And now that they're in control of Washington, they really want to make that a reality, no matter what the obstacles.